Let's get you the latest on India's battle against COVID right now. If we can get those figures up on our screens, India now reporting 2.55 lakh new COVID cases in 24 hours. It's down about 50,190 from the previous 24-hour period. Deaths, however, are up at 614 deaths reported in 24 hours. That's 175 up from the previous day's figure. Now, the major cities of Delhi and Mumbai are, of course, seeing a big dip in COVID cases. These include Delhi and Mumbai. We'll talk about all that and more in detail with experts joining us on the program now. We have Dr. Subhash Salunke, member of the National Task Force of COVID-19, who's also advisor to the Maharashtra government. We also have Dr. N.N. Mathur, Professor of Excellence ENT at the Lady Hardinge Medical College and Hospital in the national capital. Dr. Salunke, let me begin with you. In terms of the overall India numbers, would you say too early to celebrate yet, or are we seeing a distinct trend, at least in the major cities, where cases have now peaked and are obviously starting to climb down quite rapidly? At least in the big cities, would you say that the third wave is on its way out?
No, I don't think so. Third wave is definitely not way out, but the fact remains that the major metropolis cities like Delhi, Mumbai are going to show downward trend, and it is going to be kind of an repeat in other metros also, and that is the kind of an trend that you will see throughout the country, that initially in the metros, followed in the peri-urban areas, and then spill over to the rural area, and eventually there is going to be a decline. And this entire process is likely to take at least 8 to 10 weeks. This is what is going to happen in our country. And that is the reason this number, that yesterday it was 3 lakh, today it is 2.55 lakhs, shouldn't be, either create panic or shouldn't worry people in general. As far as, look at the situation. Now you just can't stop the spread of Omicron in this country. You test more people, you get more cases. So instead of 2,55,000, you have 355,000. Doesn't matter, makes not much difference. What is most important is positivity rate, and next most important is hospital occupancy or the bed occupancy and the deaths. These are the major criteria on which local administration need to take a decision. Not this total figure of India, 3 lakhs or 4 lakhs, doesn't make much difference. So let us not confuse people. What is critical is to understand that there will be the upward trend and downward trend. It will differ from state to state, metro and peri-urban and rural areas. That is the ground reality.
Okay, and those are likely to happen at different times, as you point out, Doctor.
Absolutely.
Let's also bring in Dr. Venkatraman Kola, Clinical Director of the Yashoda Hospitals in Hyderabad. Dr. Kola, we've already heard from one expert saying Karnataka figures have suddenly seen this jump, but that's because Karnataka hasn't followed ICMR guidelines. They're testing everyone, including asymptomatic patients. Now, would you say that really speaks to Dr. Salunke's argument that, the overall numbers are really not, should not be as much of a consideration as seeing the broader points of whether hospital or medical infrastructure is being stressed at all? So many people right now are actually recovering perfectly well at home. So what really are the markers and indicators that should be of concern now?
Yeah, what we have seen over the last 2-3 months from November onwards is the Omicron wave has been a rapid rise in any countries. If you look at South Africa, UK or United States of America, and we expect them to get down early also. This whole phenomenon happens over a 4 to 6 weeks time. Now we come across the testing numbers and the positivity rate and all that. See, over the last few weeks, at least the population in India now understood that the Omicron variant looks relatively milder, and the hospitalization and deaths has not been that high like what we have seen in the previous waves like Delta. And the hospitals, particularly, we had many cases in the ICU, but all of them, believe me, are of comorbid medical cases where the RAT is or the RT-PCR is just an incidental finding of being positive. So what happened is the last 2-3 weeks, the testing has gone down in some of the states and testing has gone up in some of the states. The testing is one of the concerns because many population now people who have started thinking, okay, it is a common cold variant, so stay home, isolate yourself, take care at home with symptomatically. Probably that is the reason we are seeing up downs. But yes, we are somewhere in that upsurge peak. It will take a few weeks, maybe another 2 to 4 weeks. It is too early to comment that we are seeing a downtrend.
Okay, fair enough. Dr. Mathur, would you say it's too early to say there's a downward trend even when it comes to the major metropolises, Delhi and Mumbai? You know, we're not talking about sort of the peri-urban areas or for that matter, rural areas. And obviously, like the other waves, there are going to be ups and downs in different areas and regions at different times. And we completely take Dr. Salunkhe's point about that. But as far as Mumbai and Delhi are concerned, do you believe that these numbers speak, you know, for anything, the fact that, you know, the peak is over and that we are seeing a distinct downward trend?
In all probabilities, yes. There had been consistent downward trend for last 1 week, and we have seen day by day there is consistency in that trend. So in Delhi and Mumbai, I am very confident that probably the things are on the right track and they are decreasing. Although, as very rightly pointed out by Dr. Saab, that this time, this wave is a little different, that in the ICU, the patients who are there are basically, they did not come for the COVID. They were discovered to be having Omicron when they were tested for the rapid antigen because they were there in the ICU settings. So the scenario is a little different. Earlier in the Delta wave, they had come into the ICU because of COVID, and they also had the comorbidities. So there is slight change in interpreting the figures of even the ICU and the hospital admissions.
Right. So then, Dr. Mathur, I guess the follow-up question really is, do very strict COVID restrictions have to necessarily continue in cities which are seeing a distinct downward trend? Delhi, for instance, you know, we're still seeing night curfew, weekend curfew, you know, shops opening, you know, odd and even on alternative days. Would you say that all of this is still strictly necessary?
Yes, actually, there is always a lag period between these actions. So we have to maintain that lag. When the things improve, I feel it will be very appropriate to wait for 2 weeks for the trend to stabilize. And 1 week is already over. Let us continue for 1 more week. That's what my personal feeling is, that there should be, we should watch it for 1 more week.
All right. Dr. Salunkhe, is that something you would agree with?
Yes. I personally feel some restrictions are absolutely must. We shouldn't give impression to the people that everything is honky-dory and now you can come out and do whatever you want. Nothing doing. You have to follow 2 basic things. Use of mask, non-negotiable. 2, unnecessarily conglomeration or unnecessarily bringing people together, not acceptable. Not to impact economy adversely is agreed to. However, finding a balance at these kinds of strategic situations is the responsibility of the local administration. So I feel not only in Delhi and Mumbai, but throughout the country, in spite of downward trend that may eventually come after 7-8 weeks, we must continue with these 2 basic principles. Please remember what WHO DG has stated today itself, that Omicron is not going to be the last variant. And please also remember, right now in Mumbai particularly and in Maharashtra, we have the 2 varieties of 2 variants which are circulating. Delta is circulating, so also Omicron. Who knows what is going to happen if these 2 circulating, variants come together and there could be another one. And the unfortunate part in the northern India, there is no reporting. There is not much of a problem. Now that complacency part that we see in the northern India is a risk for the entire country. And from that perspective, restrictions are obligatory, but judicious restrictions, ensuring that there will be minimum economic impact, but
Yes.
there will be as much of protection given from the perspective of pandemic is the key challenge for governments and also the administration.
All right. Thank you very much indeed, Dr. Salunke, Dr. Mathur and Dr. Raman Kola for joining us on this discussion this morning with your thoughts.